Hello everyone, I'm Dr. James. I've spent over 35 years caring for the health of people over 60 here in the United States. Today, I want to speak frankly with you about a topic that most of us think is safe, but sometimes carries risks we rarely consider. That topic is routine medical tests, the exams we undergo every year, believing we are doing the right thing for our health. Imagine this scenario. You've just stepped out of the clinic after your routine checkup, feeling fine, healthy as usual. But just a few days later, you start experiencing dizziness, blurred vision, or worse, a sense of weakness and imbalance with no clear reason. All of this can happen without warning, and sometimes the cause isn't an underlying disease but the very tests we assumed were harmless. I know that hearing this may make you anxious or even fearful. But I'm not telling this story to alarm you. My goal is to help you understand so that every time you step into a clinic, every time you consent to a test, you can ask smart questions, understand the risks, and protect yourself. Your health is not just the doctor's responsibility, it's yours too. Here's what I want to emphasize. After the age of 60, our bodies respond differently. The heart, blood vessels, kidneys, and even the brain are more sensitive to even the smallest changes. A contrast injection for a CT scan, the stress on the heart during a stress test, or anesthesia in an endoscopy, all of these can impact your circulatory system in ways we don't always anticipate. That's why the first question I always encourage my patients to ask is this test really necessary right now? Let's talk about CT scans with contrast. This is an amazing tool that allows doctors to see blood vessels, organs, and internal structures clearly. I've witnessed many cases where these images saved lives, detecting tumors, blood clots, or dangerous aneurysms early. But I've also seen healthy older adults feel dizzy, fatigued, or even experience a mild stroke after a contrast-enhanced CT. Why? Sometimes it's just a natural reaction of the body to the contrast, causing temporary high blood pressure or vessel constriction. And for those with heart disease, hypertension, or reduced kidney function, the risk is even higher. Stress tests, also known as exercise tests, are another example. In theory, they are simple. Walking on a treadmill while your heart is monitored, so the doctor can see how it performs under pressure. But for those over 60, especially with heart or blood pressure issues, a sudden increase in heart rate and blood pressure can be like placing a flame next to dry kindling. It can trigger arrhythmias, excessive hypertension, or even damage small blood vessels in the brain. I remember a 74-year-old patient who experienced dizziness and chest pressure during her stress test. The test was stopped in time, but the next day she had a mild stroke. Her doctor later explained that the sudden strain on her heart and vessels had affected a vulnerable brain vessel. Endoscopy with anesthesia, especially for the stomach or colon, also requires careful consideration. Anesthesia can lower blood pressure, and when combined with common medications in older adults like aspirin or Plavix, it can impair blood clotting, leading to transient cerebral ischemia or even a mild stroke. I often tell my patients that if there are no clear symptoms, ask the doctor if a non-anesthetized test is possible or if safer alternatives exist. MRI with gadolinium contrast is similar. Gadolinium is a heavy metal excreted by the kidneys, but with age-related kidney function decline, the body may retain small amounts, causing dizziness, headaches, imbalance, or mild neurological disturbances. I once had a 79-year-old man who felt fatigued, confused, and unfocused a few days after a contrast MRI. Only after testing his kidney function did we discover stage 3 kidney disease that had previously gone unnoticed. The reality is, not every test is bad, but not every test is immediately necessary. After 60, it's crucial to understand your body, your underlying conditions, and the medications you're taking. A candid conversation with your doctor before any test can sometimes be more important than the test results themselves. Let me be honest, you are not alone. I've seen many older adults feel anxious after seeing test results, but after thorough discussions with their doctors, they realized that many things didn't require immediate intervention. Some only needed lifestyle changes, blood pressure or cholesterol control, or simply ongoing monitoring. And it's this knowledge, this proactive questioning, that has helped them avoid unnecessary risks. Over my years caring for patients over 60, I've learned that health isn't just about numbers on paper or images on a screen. Health is the feeling of peace in your body, the confidence to step out of your home without fear, and the ability to make informed decisions, understanding every step of your own care. So today, I invite you to pause for a moment, listen to your body, ask questions, and don't hesitate to have open conversations with your doctor. Remember, every test has its value, but the greatest value comes from understanding yourself, knowing your options, and protecting yourself. We don't do this to create fear. We do it to gain peace of mind, so that every health checkup is not a gamble but an informed, thoughtful step for yourself and your loved ones. I know this may sound complex at times. But trust me, just a few minutes of conversation before a test, a few well-timed questions, can make a huge difference. We don't need to avoid tests, but we need to learn to take control of them, rather than let them unintentionally control our health. Now, let's take a closer look at some common tests that most of us undergo, but few realize can sometimes carry risks. I want to share with you what I've seen in clinical practice and how you can protect yourself wisely. Let's start with a CT scan with contrast. Many people assume this test is completely safe and simply helps doctors see the internal organs more clearly. But in reality, the contrast dye can temporarily raise or lower blood pressure, especially in those with heart disease, kidney problems, or chronic hypertension. I recall an 81-year-old gentleman who came in with mild abdominal pain. After a contrast CT scan, he returned home feeling fine, but just 2 days later, he suffered a mild stroke. The likely cause: the contrast dye may have temporarily elevated his blood pressure, contributing to clot formation and reduced blood flow to the brain. But please don't misunderstand me. I'm not saying we should avoid CT scans. On the contrary, they save countless lives, detecting dangerous issues like aneurysms, tumors, or blood clots early. The key is to have a detailed discussion with your doctor beforehand. Do I really need contrast? Can it be done without contrast, or perhaps replaced with an ultrasound? Make sure to provide a complete medical history, especially if you are taking heart, kidney, or blood pressure medications. Next is the stress test, or exercise test. Many older adults feel confident when their doctor suggests walking on a treadmill to check heart function. In theory, it's simple. The heart is monitored, blood pressure is measured, and the doctor observes how the heart performs under stress. But for people over 60, especially those with latent heart conditions, this pressure can be like placing a flame next to dry kindling. The heart beats faster, blood pressure rises, and sensitive blood vessels in the brain may be affected. I remember Margaret, age 74, who experienced dizziness and chest pressure during a stress test. The test was stopped immediately, but the very next day, she suffered a mild stroke. The stress test didn't directly cause the stroke, but it put her body in a vulnerable state because her cardiovascular system was already compromised. Endoscopy with anesthesia also requires careful consideration. Most of us don't realize that seemingly simple procedures like stomach or colon endoscopy carry risks. Anesthesia can lower blood pressure, and when combined with common blood-thinning medications in older adults, the risk of bleeding or transient cerebral ischemia increases. I once saw a 76-year-old patient who, 2 days after an anesthetized endoscopy, began losing balance and slurring her speech. Timely intervention prevented serious harm, but this clearly shows that age, medications, and anesthesia can create a perfect storm, even when the procedure itself is generally safe. MRI with gadolinium contrast is another noteworthy example. Gadolinium produces sharp images, but the kidneys of older adults may not fully excrete it. Some of the substance can remain in the body, causing dizziness, headaches, or mild neurological disturbances. I remember Harold, 79 years old, who felt fatigued and confused a few days after a contrast MRI. Only after kidney tests did we discover stage 3 kidney disease that had previously gone unnoticed. This reminds us that not every MRI is harmful, but kidney function should be checked before using contrast agents. Additionally, there are tests many people assume are completely harmless but can actually lead to unnecessary interventions, such as carotid artery ultrasound. Many are advised to undergo this test as a preventive measure, but a 50 to 60% narrowing is often normal with age. Without symptoms, seeing narrowing on a screen does not automatically mean surgery is required. I once treated Helen, 82, who was advised to place a stent simply because her ultrasound showed 65% narrowing. She suffered a mild stroke during the procedure. If she had been monitored and managed with blood pressure and cholesterol control, the risk could have been significantly reduced. Another point I want to emphasize is that everyone reacts differently to tests. A single injection, a small cardiac stress, or light anesthesia may be normal for one person but can cause significant changes in another. Therefore, the key is not to avoid tests, but to ask the right questions, understand your body, and provide a complete medical history. Finally, I want you to remember that health is not just numbers on paper or images on a screen. It's peace of mind, the ability to step outside without fear, and the right to make informed decisions about your own care. Every test, every injection, every medical decision should be made with understanding, not out of habit or diagnostic pressure, but because you want to protect yourself. Today, we've taken quite a journey together, exploring medical tests that most of us assume are harmless. From CT scans, MRIs, stress tests, and endoscopies to carotid artery ultrasounds, each test has its own value. But the key point I want you to remember is that the true value of any test lies in how we use the information it provides, in understanding our own bodies, asking the right questions, and making responsible decisions. After the age of 60, the body reacts differently. Blood vessels become more sensitive, the heart and kidneys may be less flexible, and even a seemingly harmless test can lead to significant changes. So never hesitate to have an open conversation with your doctor. Ask whether the test is truly necessary, if there is a safer alternative, and whether the results would actually change your treatment. Those small questions can sometimes make the biggest difference. I want you to understand that the control over your health belongs to you. No one understands your body better than you do. Being proactive, weighing risks, and participating in medical decisions helps protect yourself, reduce anxiety, and maintain peace of mind in your daily life. If today's video has given you a new awareness, helped you feel more confident, and encouraged you to ask more questions before undergoing any test, then I've achieved my goal. I invite you to do a simple thing. Share your experiences. If you or a loved one has ever faced an unexpected situation after a test, leave a comment below. Together, we can learn, share, and support each other to make healthcare decisions safer. And don't forget to subscribe to my channel, where I share practical, straightforward health knowledge for older adults, tips to protect yourself, and ways to live healthier and more peaceful lives every day. Give this video a like if you found it helpful, and share it with your loved ones so they can be equipped with this important knowledge too. Remember, health is precious, and knowledge is the best way to protect it. Every wise decision you make today will help you walk with confidence, live joyfully, stay healthy, and fully enjoy life. Thank you for spending time with me today. Take care of your health, always listen to your body, and never hesitate to ask questions. Together, we will navigate every health challenge with understanding, proactivity, and peace of mind.